Laser surgery.
Right.
If you're self-conscious about spider veins on your legs, we've got good news for you. Plastic surgeon Dr. Bradley Calobrace is here to show us how to get rid of them with a simple laser procedure. Wait a minute, you guys don't have your goggles.
We're ready for them.
Okay.
Right. You actually don't have them on until we start using it, so we can usually talk to our patients, but that's okay.
Okay.
As you remember when we did the laser hair removal, we had to have the goggles. These are actually a little different because it's a different laser. We actually, for the different purposes, whether it be spider veins or it's hair removal or whatever it is, there's different types of light that are produced by laser, and it takes a whole different machine. This one is called the VersaPulse, and it is very effective at treating those spider veins that are very frustrating, whether they be around the nose, across the cheek with rosacea, or more typically the ones that we find in the lower extremities.
Yes. Now, how does it work? How does this laser work to get rid of the spider veins?
Well, what it does is it looks for the light. The light looks for the blood vessel. And so the blood vessel is darker than the skin, so the blood vessel absorbs that light and destroys it.
Let's show, let's go ahead and start working here. You're working on one on the patient's ankle here.
Exactly. And let's see if we can show this. Can we see this one here? To show you the other one so it's facing the camera.
There you go. It's a nice ankle, by the way.
It's a nice ankle, actually. Now we're going to move in close so you can see it. But it is these darker, smaller spider veins. Now, it only takes care of the very small. If they're larger, then you have to do some injections with saline. People have heard of using that. Or actually do varicose vein stripping if they're much larger. But these are those very dark, very fine spider veins that actually kind of spread out and have a lot of little branches on them.
Is it ready to go? Can you, can you start the treatment
sure
and show us?
We sure can.
Now, is this dangerous to cut off this particular blood supply?
No, these blood vessels have no purpose. They're actually just injurious, and they can get larger and larger, so we like to get rid of them if we can.
Right.
And they're obviously a cosmetic issue as well.
And this is permanent, you say?
Yeah. This is permanent, but what it sometimes can take more than one treatment.
Okay.
And the process, whatever caused them in the first place, for a lot of women it's pregnancy or weight changes or trauma. Whatever has caused it in the first place may actually continue to cause, and so we may see that we have more in the future.
What's that stuff there?
This is a little gel that helps to absorb the light so that we don't injure the skin. As well, the tip of this laser is chilled to help protect the skin.
What does that feel like? Can you feel it?
It's just
You
cold.
see the light?
Mm-hmm. Oh yeah, see the light.
Is that painful at all when you?
No, not
Okay.
really. It just feels like a rubber band.
Yeah, and so we can just zip right along here.
Look at
and
that.
I'm
You
trying
see the
to
flash. Every time it flashes,
Yeah.
that's the laser.
and we just move right along, and this is how quickly we can treat them. So this is much more comfortable than getting injections with saline, and we can go through a whole leg, and we can do actually both legs in about 20 minutes. So if you can look here, all the spider veins that were there are now gone.
And it's immediate.
It's immediate.
Wow.
That's amazing.
What's important after we treat all of the legs is for people to go home and put their legs up for about 24 to 48 hours. We use compression stockings and have them continue to use compression stockings for a few weeks because once we've destroyed or injured that blood vessel, it can get blood back into it and start to redevelop. So we want to compress it and cause it to kind of obliterate itself.
Look at that. How much is the treatment?
It costs about $200 to $400 depending upon how much area we do.
Good. And we're going to put your phone number up on the screen so people will know how to get in touch with you
Great.
for the treatment. It's 326-2628. You can reach Dr. Bradley Calobrace at that number and make an appointment to have your spider veins removed. What a great thing.
Yeah, it works a lot better than a lightsaber would, right?
Yes, much better.
Okay.
Actually, but it's a little more expensive.
Yeah.
Yeah, just a little bit.
Okay.
Thank you.
Thank
You're
you
welcome.
very much.
You're welcome.
Good seeing
You're
you
welcome.
again.
Good seeing you.
Yeah,
Thank
looks
you.
great.